Hello and welcome to Health Reform Watch, a collaboration between Reuters and the Harvard School of Public Health. I'm your host, David Morgan, healthcare policy correspondent for Reuters in Washington. And with me today is David Cutler, Harvard University economics professor and an expert in healthcare policy. Professor Cutler played an instrumental role in crafting healthcare reform rules for the state of Massachusetts. Hello, Professor. Welcome to Health Reform Watch.
Thank you. It's very good to be with you.
Professor Cutler is here to talk to us about a new Supreme Court case called King versus Burwell, which could threaten the Affordable Care Act later this year. At stake in the case are the federal subsidies that are made available to consumers in 36 states to help pay for private health coverage. Plaintiffs in the case allege that those subsidies should not be available through the federal health exchange that serves those states, but instead should be available only through state-run exchanges in 14 states and the District of Columbia. Experts warn that if the Supreme Court rules against the administration in King versus Burwell, there will be a tremendous upheaval in insurance markets in 2/3 of the country, and there will be tremendous pressure on political operatives to cope with the issue. Oral arguments are scheduled to begin before the Supreme Court on March 4th, and a ruling is expected by the end of June. And so my first question for you, Professor Cutler, is this. If the ruling goes against the government, then how bad could things get? What sort of toll would you expect for consumers and healthcare providers, including hospitals, doctors, and health insurance companies as well?
I think if the ruling goes against the government, it would be a very big and bad situation. So the first thing that would happen is that subsidies to individuals buying on federal exchanges would disappear. Effectively, many people would face an enormous increase in the price of insurance. Particularly young and healthy people would decide to drop out of the market. That's going to mean that the insurers will not be collecting enough premium from those who remain to make things balance, so that over time they will need to raise their premiums, driving away people who are healthy and increasing the average sickness of the risk pools. Effectively, people estimate that probably 8 to 10 million people who are currently insured through the exchanges would lose their insurance coverage. So that would be a massive dislocation of insurance coverage. In the short run, what would happen would be that insurers would stop paying bills to providers on behalf of people who are no longer paying for their coverage. To some extent, the loss will be borne by insurers because there will be some payments they will make before they know if people are dropping their coverage. And to some extent, the loss will be borne by providers who will be seeing patients, and ex post, the insurance company will say they're not paying for them because they weren't paying their premium. One way or the other, the services that are used by people who become uninsured will become a burden on insurers, providers, or the rest of society.
So it sounds like it could be a death spiral for the federal exchange. Does it necessarily mean the end of the Affordable Care Act as we know it?
It would essentially be a death spiral for the federal exchanges. It's not necessarily the end of the Affordable Care Act for two reasons. First, the state-run exchanges should do fine. So states that are running their own exchanges tend to have their own insurance companies, their own risk pools, the subsidies would remain. So they're largely insulated from what's going on elsewhere. That is, to a first approximation, insurers don't price one state based on abnormal claims experience in another state. So that's the first part. The second part of the ACA that would remain intact is all of the changes to Medicare and all of the other changes designed to increase the efficiency of the system by, for example, changing from volume-based payment to value-based payment, by conducting various operational changes in Medicare. But make no mistake, it's carving a very big part out of the ACA.
What do politicians and policymakers at the federal level do? Are there ready solutions that can be taken up, or is politics going to complicate everything should all of this occur?
Politics will undoubtedly complicate everything because it complicates everything about the ACA. Ironically, the easiest way to fix such a ruling would be at the federal level. So Congress could pass a two-line bill that fixed everything. The two-line bill would say that the subsidies are to be paid in federal exchanges as well as state exchanges. That would end the whole situation, no problem. There's an issue as to whether the side to blame will be the Republicans, who have so far not indicated they would be willing to do this, or the Democrats, who will want a very clean bill that would do just this. So the Republicans will argue that this is an opportunity to change the Affordable Care Act and the president is going to be standing in the way. And the president and the Democrats will argue that the Republicans can fix this and then have a different discussion about health care, but that we shouldn't let this get in the way of people having insurance coverage.
And so the final solution at the federal level may depend on which side feels the heat of blame.
Yes, and there is that, but there's also going to be the fact that the need to act will be immediate. So, for example, if the Supreme Court says that the federal government cannot pay subsidies, the premiums to individuals will rise right away, and within a month, people will stop paying their premiums. Within 2 months after that, those individuals will no longer be covered, and the providers will know that. So the effect is that if Congress is going to address it, they're going to act right away. They won't have time to pass legislation that calls for some new process, some big new proposal to roll out, some 18-month implementation. They're going to have in the matter of weeks, not in the matter of months or years. I think it's interesting. There are 2 points of view, and you've seen them in the past few days. One point of view is many Republicans who are elected from states or districts that the president won or did very well in. There are many more of those Republicans who are up for re-election in 2016 than there are Democrats in in races at the margin that they have to defend. So those Republicans are going to be under very clear pressure to do something, not to make 8 million people be uninsured. On the other hand, the people who just won office in the last election were elected on the grounds that they were going to overturn Obamacare. They were not going to get some very small concessions to Obamacare. They were particularly not going to continue a large subsidy program with very small concessions from the president. So the Republican base that elected the Republican Congress seems like it will be extremely unhappy if this is used for anything other than complete dismantling of Obamacare. That creates the possibility of effective Republican civil war around what to do in that circumstance.
Which could empower the Democrats.
The Democrats are almost certainly going to be united that those subsidies have to come back and that the changes in Obamacare must be fairly minor. Of course, there are things that the Democrats would agree to do. There's things that everybody would agree to do to change the Affordable Care Act. But essentially, the Democrats will want to keep most of it in place. There's probably, if one thinks about it, the Senate is more likely to be conciliatory because there are many more senators from up in the air states who will need to show something. On the other hand, most of the House members are unlikely to show any sympathy towards extending the subsidies. And so you could have a situation where it's a fair number of Senate Republicans, almost all Democrats, against most House Republicans and many Senate Republicans.
Can individual states take actions that might solve things for their constituents?
Individual states could set up a state exchange. They don't have to do all the back office processing, all the website information on their own. They can contract that out to the federal government. That said, they have to do a little bit. So if the bill that the federal government needs to write to solve this is 2 lines long, the state bill needs to be several pages long. So they need to authorize a state exchange, make sure it follows all the rules about participation and so on, and then agree to contract with the federal government to run the system for them. They could do that. They could do that very easily. It could be done within the time frame that between a Supreme Court ruling and when people would stop paying their insurance, but many governors will be in a very difficult position with regard to promises that they've made about it.
Well, we'll just have to see how things play out. In the meantime, thank you, Professor Cutler, for helping us tackle this complicated and very interesting and actually disturbing for healthcare beneficiaries, this topic. Thanks also to our viewers for joining this edition of Health Reform Watch. I'm your host, David Morgan. See you next time.